Welcome, welcome, welcome to episode 218. Are you ready? Advanced Systems for Crisis Care. My name is Laura Evans, I'm the AVP of Public Policy and Government Affairs with Vibrant Emotional Health, and I'm super excited for today's featured presentation with Monica Johnson. It is going to be very exciting, so I hope you're ready. Let's get into this episode. Again, just a quick reminder of our rules, not too many. If you need to, if you prefer, and I recommend speaker view instead of gallery view, that way you can see who's speaking in the slides. Make sure you join in, drop your thoughts in the chat, questions, anything you want. Make sure that you participate. We're gonna have some polls. We may be asking the audience for thoughts and feedback. So if you can, use that chat, participate as much as you'd like. That it keeps the jam fun, but just remember to stay on mute unless you are speaking. All right, and again, we have this new ASL feature for folks who would like or prefer sign language interpretation. If you go down to the bottom, I think right for me, there's a button for more, and then you can pin sign language interpretation.
This is just a list of most of the prices there. Mine is insane.
But we do need to remember to stay on mute unless we are speaking. So only rule. With that, we have.
But not you, Laura.
Not me. So thank you. Sorry about that. Please do remember to stay on mute unless you are speaking. And if you have been one of our 546 unique speakers across 218 episodes over 5 years, then you will see your name come up on the next slide here. And again, very honored to have all of these unique speakers. And if you have a topic, something that you are doing in your center, your state, as a person with lived experience, living experience, make sure that you reach out so that we can get you featured here. That is the only way we are going to learn from each other and get better. All right. So again, you can go to talk.crisisnow.com. You'll see Monica's lovely face here. From this website, you can view the streaming. You can see other episodes of the Jam, other materials of like, hey, that was a good presentation. I want to go back to that. You can find all of that in our learning community at talk.crisisnow.com. And you can also register for the Jam. We do need to keep it safe and fun for everyone. So we prefer people register first. You can get virtual backgrounds. You can see what's coming up. Bookmark talk.crisisnow.com. All right, and we've got some recent highlights here. We've got the debate that happened last week. We'll get more into that later in this Jam. But again, everything you need, everything that has been discussed will be on this site. Let's say you want to go into the archives. Well, we've got those as well, and they're actually color-coded. So you'll see some are yellow. We've got fireside chats that are orange, debates that are neon. So we try to make it easy. David and team tries to make it easy to find what you need. So highly recommend checking out YouTube and the archive of episodes, as well as Moving America's Soul and the World Soul on suicide. So our debates, we've got a number of debates happening. If you missed last week, you missed a great debate between Hannah Wesolowski and Tom Betlock. And that was centered on if states should have a 988 fee. And so you'll see some of the other debates here. Yes, 5 and 6, but debate 7 last week. 48% of folks said yes, all states should enact legislation that includes a 988 fee. So Hannah did an amazing job of affirming that position, although Tom did really well in saying, you know, a fee is one option and states should consider braided funding and other state appropriations mechanism. So we saw a lot of folks who were maybe not sure, and they did move. So we had some who moved to no fee, but the most people moved to yes, there should be a fee. So I think the real winner is sustainable funding for crisis contact centers and the continuum. So with that, we'll have our eighth debate coming up, and that is, should crisis facilities require parents to stay during a crisis episode? We have Gwenda Summers, who will be taking that affirmative. And if you know someone, if you are someone who would like to make a strong case for why parents should not be required to stay, we would love to have you featured. Or if you got recommendations, please make sure to reach out. That's June 18th, and that should be a good conversation. And then in July, we'll have a debate on coordinating follow-up services in crisis care. Does that require high-tech software solutions? We've got, well, if you want to be on this debate, please reach out. Again, required being the key word, or is there a low-tech way to do it? Crisis Jam will be live on location in Columbus, Ohio, later, I think this month or in June. So that is really exciting to see the great work happening in Ohio. Again, they're going to have crisis beds, observation, recliner chairs. And again, it's all in the goal of how can we ensure that folks have what they need, not a one size fits all, and that cities, states, localities are participating. So live on location in my hometown of Columbus, Ohio, the Adam Board of Franklin County has a large investment here, over nearly $60 million, 60 recliners, 16 inpatient beds. And we had a live in location in Salt Lake City. So it will be interesting to see how different states, different localities approach this. So very exciting. Look for that on June 4th. And we'll have Erica Clark Jones, Jonathan Thomas, Joy Brunson. So, and okay, sorry, I'm out of order here a little bit, but we're going to keep going forward. And we are going to take a look at some interesting news articles, including one of an art installation in, I think, South Dakota, where folks were encouraged to write notes on a wall related to the 988 hotline, and just something for folks to keep in mind as they may be struggling, going through a hard time, and those notes of encouragement are so important. So great work, South Dakota. And then from our friends at APA, a new poll that they have commissioned or released reveals that Americans are anxious about current events, and 40% are worried about their job security. So again, that we're seeing folks being anxious, and that's okay because the 988 Lifeline is here for anxiety. It does not have to necessarily be a suicidal crisis. So any sort of emotional distress, and it does sound like more Americans are becoming concerned. So thank you, APA, for commissioning that. All right, well, now we are coming to the Crisis Jam Showdown, right? I won't read this text to you, but in short, prior to 2001, there was little consistency in standards and trainings. So centers were sort of the Wild Wild West. Well, with that, SAMHSA partnered with the American Association of Suicidology, AAS, and they began to certify crisis contact centers. So again, laying that groundwork for professionalizing the field and saying, hey, these are the minimum standards that folks need to reach. Today, there are multiple accrediting bodies, which is the accrediting body for online emotional support services through chat and text. Make sure you fill out the poll here. And I'll be honest, I got this one incorrect. Anyone want to put in the chat what they're thinking or raise their hand? Do we have you stumped? Okay, we have some guesses of C. Is that a real guess, or is that the standardized test guess of just guess C?
Laura, why don't you call on Justin Chase for his thoughts?
All right. This might be a little too on the nose, but Justin, why don't you let us know? What are your thoughts in guessing C?
I know this a little too well, I think, as a board member, but ICH, International Council for Helplines, has been doing this under its prior name of Contact USA, has been doing this for a number of years. So,
Yes. Well, thank you, Justin. Appreciate your work. You had the audience, 42% said ICH, and we appreciate all the work that ICH does. And I'll also note that Kelly Clark is also a board member and a former Vibrant staffer. So thank you, Kelly, for all of your contributions. And thank you, Justin and ICH, for all the accrediting work that you do. For folks that are familiar with AAS, they also accredit crisis contact centers. And you can find all the centers that they accredit in the US and Canada on their website. And this is a little screen grab here. CARF, and I'm going to ask for forgiveness because I know what CARF stands for, but I cannot think of it right now. They also have a site where you can check their accrediting organizations or the organizations that they have accredited on their website, find a provider, screen grab here. So I think what is important here is that we are no longer in the wild, wild west of contact centers, but now we do have very clear standards of training, operations, and support. All right, and then a final NAT accreditation and dual diagnosis for mobile teams. Always an important part of the three-legged stool for crisis services. And so we want to make sure that our crisis teams are able to provide assistance, especially for those who may have intellectual or developmental disabilities. So very important work. Again, thank you to all of our accrediting bodies. So I am very excited for our featured presentation because I've had the pleasure of working with Monica Johnson for some time. And so very eager to have her give her presentation. Monica, I'll let you introduce yourself, but for those, I'll give a tiny preview of just how long Monica's been here. She has just wonderful experience across both state and federal, perfect nexus to be our featured presentation. So Monica, I'll give the floor over to you.
Thank you, Laura. Hey, everybody. I am so excited to be here. I think the last time I may have been in a space similar to this, Justin, I heard you come off mute to answer the accreditation, was at CrisisCon, which was in October of last year, I believe. So excited to be here. Again, my name is Monica Johnson. I am currently a managing director for behavioral health at Health Management Associates, known as HMA. I will be talking to you today about a little bit of where I left off, if you heard me talking CrisisCon, now that I'm sitting here thinking about it, which is how do we continue to move the transformation that is happening across this country related to behavioral health crisis services. I am the former 988 director at SAMHSA. I do want to give a shout out to my former colleagues who are working very hard behind the scenes to continue the work. I want to say hello to anybody that is here that is from a crisis contact center that is still pressing through and doing the work in complicated times. And I'll talk a little bit about how you continue to do this work and build this system out, even when there is uncertainty or complexity around us. I do want to shout out the Lifeline administrator, Vibrant Emotional Health, who again is continuing to do this work. And thank you to David Covington and RI for inviting me to be in this space. It feels like home, and I just cannot be more excited. I dreamed about this. I told them that earlier today. I was so excited about today. So I have 15 minutes to say a lot of things that I want to say to you all, and I'm going to set a timer so that I can try to get all of it in. So Laura, I set a timer. So for those that aren't as familiar with me, prior to coming to SAMHSA, I was in state government in Georgia. I live in the Atlanta metropolitan area, and I was in state government in the Department for Behavioral Health and Developmental Disabilities for 12 years. I have a lot of experience in the provider space, over the behavioral health continuum and have seen it from different lenses. And so I feel like I'm in a good position to be able to swoop in here, give you all some reminders. Some of this you will know, maybe it'll be aha moments for others, but how we continue to move this work forward. Before I jump into my presentation today, I do want to just say a little bit about what HMA does. We focus on providing answers and solutions to complex healthcare needs, and we'll be talking about that from a behavioral health crisis perspective today. You can advance. I do want to say that people don't realize this, how deep the bench is of experts for behavioral health that we do have at HMA. So again, we focus on public sector work, which feels really important to me. I am a mission-driven person, and I need to be doing work that feels like it is following the mission that I care about. And advancing behavioral health for me is a personal mission in this country, and I get to still continue to do that work. Next slide, please. So the last time I got to talk to folks in this space, I used the Game of Thrones analogy, and people have asked me since then, did you know you was not going to be in that 988 seat when you gave that presentation? And I did not know, but what I do know is I have been around government for a really long time. And I understand that government is a game of musical chairs, and that people will move in and out of seats, and that is what's supposed to happen. What you should be doing, if you have watched how government works and you watch how system evolutions happen, you should be paying attention to how do we make sure that the work we do continues no matter the who. I said that I am not clairvoyant. I said that in a time where I did not know, what I would be doing on May 21st of 2025. So I want to anchor back to that and then bring us forward to today. So I do want to talk about one of the primary aims of 988. It was being a catalyst for transforming behavioral health crisis systems in this country. That has not changed. And I heard that in the intro of this. I know this is just one example, but the Columbus, Ohio center that Laura referenced that is going to be opening soon, if it hasn't already opened or early opening, that work is still continuing. People are still working. Leaders across the system are still working to develop and transform a much more robust, a coordinated system of care as it relates to behavioral health crises. And then I saw some of the stats that Laura talked about related to an increase in individuals. I think it was 67% feeling more anxious, stress, and I think it was 40 something having concerns about job stability. Those are facts that many of us are dealing with, not just people that we don't know about. Most of us know someone or are actually feeling that right now. So keeping that as the backdrop, I want you to keep that in mind as I drive us through this conversation. So I'm going to say states maybe sometimes, and I want to say off the top, I mean states, territories, counties, local government, cities, parishes, tribal nations, whatever it may be, territories. When I talk about local work that is continuing to happen and needs to happen in order to continue this transformation. So there are some key things that I think we should be thinking about as we continue to build this work forward. We should be thinking about leadership. These are things that are important when you build a system of care. You need to have dynamic leaders that are not doing the work because they're focused on themselves. They're doing the work because they are constantly thinking about what needs to happen. How do they support the people that they work with, people that work for them, people that work alongside them, but leaders that are willing to push beyond the status quo, leaders that allow you to think and have the vision to move things forward. That becomes important. And so I'll say more about this as we kind of go through today, but leadership matters so much in these spaces. Funding and payers obviously is really critical as you're thinking about building the systems, figuring out how to be more diverse. Behavioral health care providers typically sometimes tend to to lag behind the physical provider world in terms of diversification of funding, really thinking about how do you diversify that? How do you make the case to foundations around why they should support some of the work that you're doing? For example, being able to be a provider that can take a variety of different payer mechanisms. So setting yourselves up, setting the services up to be able to do that. Having a really targeted focus on what it means to build quality programs and what those outcomes should be. Knowing that when you're going into building any type of continuum, being able to make changes along the way, but understanding how you're going to measure that. What are going to be the data needs that you're going to have to be able to tell your story? And just kind of jumping out of order a little bit here, I have impact story. You have to be able to, when you're building a system, when you're in the system, whatever it is, wherever you're at along the continuum, how are you going to be able to tell the story about how what you're doing is making an impact? It is really good to have stories. It is good to have anecdotal stories, but it is also very important to have data-driven services that you can use data to tell any audience, any legislator, anyone that may be interested in funding or supporting your work immediately why they should partner with you, immediately why they should put money behind what you're doing. You need to be able to do that quickly. And knowing the quality, knowing what the outcomes should be, knowing the impact, the difference that you're making in communities, being able to do that quickly. Is the work that you're doing as you're building out your behavioral health crisis system, is it making a difference in the amount of individuals that are being boarded in emergency departments? Is it making a difference in, maybe there was a cluster that had a high incidence of suicides? Did it drive down some of that activity? Are you saving lives? Do you have sheriffs not as upset with your system anymore because they don't feel like jails are being used for mental health crisis facilities instead? Are you making a difference? Are you demonstrating that kids are able to have higher graduation rates, or you've impacted truancy? Are you making a difference? Is homelessness rates down because of the crisis system that you're building? Those are random examples, but I'm pretty sure that they can be applied to most anything. These are the kind of points that you want to be able to tell as you build out your system. So going back to thinking about the provider network in the workforce, oftentimes we do not understand we don't understand why maybe workforce. So we talk about workforce as a big old umbrella, right? What I want to lean into right now is retention and understanding what is happening in provider networks. Sometimes there is not a great relationship between maybe policymakers and the provider community, figuring out how to collaborate better and listening to the people who are actually having to implement the policy that you may be putting forward. If you're in a position of being a policymaker, thinking about what that looks like. If you're on the position of being the implementer of that policy, you're a provider, being able to have a voice and a seat at the table of that makers, to be able to let people know how this is really playing out on the ground. What happens is when people don't feel like their voices are being heard, don't feel like people are listening to them, it impacts individual morale, it impacts retention, and you don't really know how to address some of those things if you don't have a good ear to that. So making sure you have a communication that's two-way between policymaking, system design, and the people who actually have to do the work. Figuring out the technology. This is an area behavioral health sometimes often drags behind again, making sure that we have technology that makes us competitive, that makes us good partners to primary healthcare and other parts of our ecosystem. And then ecosystem collaboration. We will never be able to do this work alone in a silos. Behavioral health, providers, leaders, put anything that goes in that bucket We cannot solve for all of these challenges alone, and we don't own all the pieces to do so either. So understanding what the ecosystem of the other partners and collaborators and stakeholders that exist as you're thinking about how do you continue to build out and really design a sustainable behavioral health crisis system of care. Next slide. So how do you do that in complex environments? So public health care providers are often faced with developing accessible and effective services in unpredictable and complicated times. We've learned some things along the way, though, to help us prepare for this moment. Depending on how old you are and what you were doing, you can go back to think about 9/11. You can go and think as early as maybe 4 or 5 years ago to the pandemic. We had to do things differently. We had to be agile. We had to be adaptable. We had to try things that we were normally maybe the week before the pandemic were not trying to do, was not allowed to do. So we have learned some lessons that we need to remember as we continue to drive this work forward, because stopping or going backwards is not an option. And so what are those lessons that we have learned? What we do know is that in times of stress, that people will still show up for behavioral health crisis needs. That's going to happen no matter what. So the system has to be ready to respond to that. It doesn't matter what's happening in the environment. You heard some of the data earlier. People are still going to need you, and you're going to need to be able to show up for the system. The system cannot break. Innovation moves systems forward. You cannot have a business as usual attitude. You take advantage of the complexities. You take advantage of, well, this may be an opportunity to try something different. Innovation will drive you forward. Doing what you always did may keep you stagnant. Strategic planning efforts that you engage in have to be flexible, and it cannot be a document that you do painfully once a year or once every 3 years, and you put it on a shelf and you don't even look back at it. It has to be something that is a living, breathing document that is helping to drive you to be adaptable to various scenarios, so that you can be flexible and be responsive without having to throw your whole plan out the window. High impact yields higher prioritization. The more you can demonstrate the impact, the more value is associated with the services that you do, the services you are trying to design, and the services that you provide. Impact is vital, and you have to be able to communicate that. Be thinking about how do you tell the story of what you are doing easily in an elevator. You may be next to a legislator. You don't know. You got to be ready to tell the story and the impact of the services that you do makes. Active collaboration and coordination. This is not just about people coming together over lunch to talk about the services that they're doing. It is really rolling up your sleeves and finding out, what do you bring to the table that I don't, and how can we work together? How can we leverage resources to be stronger together? Because during complex times, those partnerships become even more valuable. You need each other. You need to think about what am I missing? What expertise don't I have? Find that partner to bring to the table to propel you forward. Next slide. So you'll get this deck. I won't have time to go through each of these, but I'm gonna try to highlight. This is Monica's made up stages of system development. I need to copyright this at some point, but I have had the honor to see and hear and visit and understand where different states are, different municipalities are, as it relates to their development of their transformed behavioral health crisis system. And you fall into one of the 4 categories, either beginner, novice, competent, or advanced. You can see some of the, Laura, that's my timer, give me a minute. You can see some of the things that I associate with what goes in which bucket. What I want you to take away when you get these slides is you need to know where you are. You need to understand where your system is. So if you're a provider within a larger system, you need to understand where the larger system is, not just how you perform. This is important because that helps you understand, it's insight. So you know how much work you have to do, you know where you need to start and where you can focus on. Baby steps matter, all steps matter. So it doesn't matter if you're at the beginner stage or if you're at the advanced, there's still work that needs to be done that you can be doing to continue to advance your system. Next slide. Transformation happens in unexpected spaces. I made that up. You can take that. That was free. And I also made this up. If we agree that building the system we want for generations to come matters, we do the work today. You understand what you can plan for versus what you cannot, then you plan it. Perfection should not be your goal. The goal should be progress. Did you do something better today than you did yesterday? Did you make an incremental move in your system? Did it help one more person? That's fine. Incremental change is important. Ask for help when you need it. No one entity or person can do it alone. You can't see all of your blind spots. You know what you know, but you don't know everything. No one does. So going back to bringing in help when you need it. System change takes time and it takes several steps forward and sometimes a whole bunch back. As long as you loop back around forward facing, you're okay. It's okay to back step a little bit because you need to learn from the lessons. Sometimes you don't get it right. Sometimes you have to fail in order to learn, and that is okay as long as you remember the lesson and you continue to go forward. Don't be paralyzed by fear or by fear of maybe we won't get it right. Next
Monica.
slide. I think this is the last one. So I leave you with where I started, which is really thinking about how do you communicate your message? How do you have the right leadership? Think about the things we led into with. And here I leave you with some things to remember as you kind of book in thinking about advancing your system as you build out your transformative behavioral health crisis system. And that's it. Thank you. I
Thank
feel
you.
like I had to do like a what is it, speed dating? There's so much we could talk about in this space, but hopefully that got people what they need to be thinking about as we move forward with this transformative work.
Thank you so much, Monica. You just proved exactly why you were so important to the 988 Behavioral Health Office, to this work. That synthesis that you just did has been amazing. And I think you'll see lots of kudos. Folks want the information in the chat. So we're going to come back to you, but I want to bring in a roundtable to give their reflections and thoughts on what Monica just shared. So let's start with Dr. Jessica Pollard, who's the Senior Behavioral Health Advisor with NASHBID.
Yeah, I
Any
was thinking
thoughts?
absolutely lots of thoughts. One of which is if there's only two of us, I don't know if it can be a round table, but we'll figure out the geometry there. I really appreciated the framework, the setting the stage as somebody who previously sat in a state leadership role as we were planning for 988 implementation, as we were thinking about that as an opportunity really to kind of reset. So we had crisis services in place. We had some things that were working really well. We had a lot of challenges. And 988 was one of those, I think, golden opportunities to say this is a catalyst or a pivot point where we can think about this as a way we can shift and get away from that. This is the way we've done things, or this is the way it is kind of mentality. So the things that I was thinking about as you were sharing your perspective, Monica, is that idea of never stagnating, always moving forward and fail and not being afraid of failure. If you're going to fail forward. And if you're moving and you stumble, at least you're going to stumble forward. So I think a couple of other things I wanted to just build on a little bit if I can. I remember very naively early in my tenure thinking, well, I don't want to bother these providers. They're busy, they've got a lot to do. They don't want to hear from some bureaucrat. They probably don't know who I am or care. And that was so wrong because when I was getting out and meeting with people and visiting with people, here I originally thought I'd be interrupting their day, but it did matter to have somebody in a policy position having FaceTime with people who are doing the frontline work. And I, sometimes have to learn lessons repeatedly. But the more I got out there, that two-way communication, absolutely important. People need to feel heard. They should be heard. And, feeding your information back because you know, sometimes you think, oh, we got that message out, but it's a repeated message before it really sinks in. You can't put out one press release and think you've communicated, effectively to all these people across your state about some things that are really complex with a million competing things to be thinking about and talking about. And I think, maybe there's a thing, maybe it's me, maybe it's a psychologist thing, but, you know, when you're being a therapist, when you have your clinician hat on, that humility is so important, being humble. And I think we have to force ourselves to shift to tooting our horns, really saying, like, look at these successes, look at this impact. I spent time as a therapist, as somebody in academia. It's not enough to just go publish it in a journal. We have to be marketing our successes to, because I completely agree. If you want people to continue to invest, then you have to really be shouting that message from the rooftops about what good the work is and how it can impact communities. I did not take a note from Monica on looking at time, so I have no idea how long I've been rambling. So I'm just giving Laura a little side eye here because I have more comments I could make, or I could cede the floor.
Well, let's bring in Wendy. We have another roundtable participant, so I want to make sure that we get some time for thoughts from Wendy Morris, who's also with NASHBID. So, Wendy, what are your thoughts?
Great. Yeah, it's always wonderful to hear from Monica. She's just phenomenal and loved the comments that Dr. Pollard made. I'd want to talk for just a minute about one of the things that Monica really emphasized, which is that idea that we have to have I think she called it ecosystem collaboration. So I've spoken a few times on the Jam about a project of national significance called the Link Center. It's funded by ACL, but we did partner with SAMHSA on a 988 Policy Academy for 6 states. That was pretty powerful. And the Link Center, there are 4 key partners, right, that are collaborating. The 4 national associations, the one for developmental disability, state directors, one, NASHBID is one, the National Association for Dual Diagnosis, which we learned earlier today, does accreditation for crisis systems, and then NASHA, the Association for State Head Injury Association. And the goal of the Link Center is to improve services and supports for people who have co-occurring mental illness or mental health challenges, and then either intellectual developmental disability or brain injury or other cognitive disabilities. And so so not only are we a good example of collective impact and kind of that ecosystem collaboration, but the 6 teams we brought together for the 988 project had cross-system teams as well. And some of the lessons learned, number one, is how critical that was. We also learned how critical it is to have the voice of people with lived and living experiences, as Monica mentioned. We learned that there continue to be a lot of myths and misperceptions about people with disabilities who can and do, in fact, suffer with mental illness, who can, in fact, benefit from treatment, and need to be able to call the 988 crisis line and get the help they need. We know that strategies for communication for this population are extremely important, as they are for all people. And we learned how important it is that call center staff and first responders get ongoing support and training to provide services to people with complex needs or communication struggles. And so a lot of what Monica talked about just really hit home. Like Dr. Pollard, I was in a leadership position at the state when 988 was rolled out, but continue to do some of that work with the Link Center. And I will put that in the chat so people can look at it in a little more detail if they want to. Thanks.
Thank you, Wendy. I was really struck listening to the roundtable and what Monica shared, that so much of this is, you know, the communication piece, right? Making sure that we're communicating the value of the program, tuning our horns, as Jessica mentioned, for the good work, but also, as Monica mentioned, you know, making sure that we know we're not the smartest person in the room, right? There are others who know more, and we need to have that active communication and with them and collaboration with them. And sometimes that means just reaching out, as Jessica mentioned, to start at the lunch meeting and then let's roll up our sleeves. So, you know, I just want to thank you all for your perspectives. You know, this is so important and we need everyone's voice at the table. So I hope folks who have heard this, even if you're not in a leadership position, you may be a consumer, you may have a loved one who's struggling, your voice is still important and we need you here. And again, I'm going to tie it back to the jam of like, you may think like, hey, I'm not an expert, I don't know. We need your unique voice. We need your topics. We need, you know, whatever you may be thinking about, because that could just be the missing link to making sure that services are improved in your community. So please do not be afraid to share that. So we're wrapping up, but Monica, I'll give you 30 seconds for anything you want to close us with on this section.
Just thank you. I wrote it in the chat. Just thank you. I love it here, and I really appreciate the way you just ended, how you leaned into, even if you're not like here because you're in a leadership space, you're in this, you know, clinical role. The voice that is the most important in this space is the voice of lived experience, and so that just cannot be underscored enough. So just thank you. And the roundtable was also awesome. So just thanks to you all for having me.
All right. Well, thank you, Monica. We'll have to make sure that you come back. Now I'm going to turn it over to our friends at NASHBID for a NASHBID update. And so I'm going to allow you all to introduce yourselves and share the update for us. Annalise or Commissioner Atkins, are you all with us? Oh, there we go.
Yes.
Yes.
Can
Thanks
you
for
hear
having
me
us.
okay? Yes, thank you.
I believe that we have a PowerPoint ready. Thanks. Hi, I'm Annalise, everybody. I'm the 988 coordinator for the state of Kansas. And I'm here with my commissioner, Drew Atkins.
Hey, everybody. And I might have to invoice Brian for and Annalise. I have a D in my name, not a T, but it's okay. I like to give everybody a little bit of grief for that. So I'm not going to spend a lot of time. I know we don't have a ton of time, and I want Annalise to get into the meat and potatoes, but we're thankful. Kansas is always thankful for the opportunity to present on crisis in 988 and what we're doing in Kansas. We've got some pretty cool initiatives and programs. We are very blessed in the state of Kansas to have a 988 fund that the legislature gave us, state general fund dollars to the tune of about $10 million that goes above and beyond anything that we get from the federal government. So again, we're just very, very thankful. And Annalise, I will turn it to you.
If you could just go to the next slide, please. So just to give a little bit of context of where suicide is in the state of Kansas, we saw a 51% increase in the death rate between 2011 and 2022, prior to 988. If you could go to the next slide. And so just covering what Drew just mentioned in response to both the federal government and what we were seeing in state, Kansas passed the Senate Bill 19 that established that $10 million annually from the state general fund. We also have been a part of cohort 1 and cohort 2 SAMHSA funding for 988. And so overall, that brings our total funding currently to about 11.9 million annually. Next slide. And how that's currently distributed is across 5 call centers or contact centers. We have 5 partners, 3 county contact centers and one that covers the rest of the state, headquarters Kansas, and that covers 102 counties. From there, I have learned that we're unique, or one of the few states rather, that have an in-state backup. And so we have an in-state backup to everybody else. I know that this is a little confusing. How it works in Kansas for 988 is that if you live in one of the counties with a contact center, those calls will go directly there. If they don't pick up, it goes to headquarters. If headquarters doesn't pick up, then it goes to health source before it flows out to the national backup. Our newest contact center is Wyandotte. And what currently headquarters Kansas is primarily taking all of our chat and text. Health Source just got onboarded. I say just back in November. And so they've begun taking chat and text, and pretty soon we hope to onboard Johnson County and ComCare. Next slide, please. And so you can see over the past, well, from December to December, rates have essentially been going up in Kansas for all three modalities. And we expect to see that increase. So that's why we've been really pushing funding into all of our centers. Next slide, please. And just another way of looking at contacts, both through all three modalities and how they've been answered in state. Next slide. Could you click one more time? Thanks. So really quickly, this is where Kansas is looking as far as our monthly average, monthly answer rate compared to the national average. You can see some dips. Definitely the implementation of geo-rounding took some of our centers some workforce adjustments to keep up with the increase and decrease of contacts. We also had a dip in our progress with onboarding new call centers and changing how our queue, how people entered into our queue, rather. So overall, pretty close to that 90% goal, but you can tell where we've definitely had some challenges. Next slide. Some exciting things. As everybody is trying to integrate 988 with other services, some of our most successful integrations have been where people are geolocated. We're trying to understand the best way to integrate across the entire state. And that's really our biggest challenge. We'd love to talk to other states and see what you all are doing. But currently, I believe there's, correct me if I'm wrong, 112 PSAPs. And each one of them has a 988 button, but now we're trying to build confidence of dispatchers that they feel good about transitioning and sending a call directly over to 988. And that's through trainings, outreach, and any other means that we can. Next slide. And some other collaborative efforts as far as our mobile crisis. There's statewide mobile crisis, but again, definitely seeing some of the better collaborations in those with counties, county contact centers. Um, Otherwise, we still have those two referring contact centers, and we are looking to increase that efficiency every single day. But that is one of the points that we are looking to do more work in. And I believe that's everything. Thank you.
Yes. Well, thank you. Again, Kansas knocking it out the park. Every state is doing something a little different. So thank you, Commissioner Adkins. My apologies for getting your name wrong. And Annalise, thank you for your support. Very excited to see the collaboration there, and look forward to hearing more. So at this point, I'm going to transition it to Stephanie Pasternak from NAMI to share a state update around funding.
Great. Thank you, Laura. And I know we're short on time, so forgive me for being as efficient as I can here, folks. Just wanted to touch on 5 states briefly. In Texas, we did have a fee bill pending there, House Bill 5342, but just to let you know, that was actually amended to take the fee out, but does create a dedicated 988 trust fund and also authorizes a study to report on sustainable funding for 988 in the state. And hopefully that can serve as a foundation for future legislation as well. That bill has been, again, passed out of the House and is now in the Senate. I'm sorry, has passed both chambers and now is awaiting the governor's signature. Also, we were watching a fee bill in Alaska, but their session actually ends today. But they have a 2-year session, so we will see if that is taken up again next year. Also, Rhode Island has a fee bill pending. That is House Bill 6128, and that has a hearing. It's hearing in the House Finance Committee tomorrow. And then just a couple quick appropriations updates. Ohio is going through its budgeting process with House Bill 96. That has already passed the House. It is now in the Senate, and that is where advocates are hoping to bring in an amendment that would actually increase the total amount of 988 funding from around 40 million to 60 million over the biennium. And finally, in California, Governor Newsom released his May budget, and that would add an additional 17.5 million in one-time funding into the state's 988 trust fund. Ultimately, the legislature gets to decide what to do with that proposal, but they have a June 15th deadline to finalize their budget. So hopefully we see that included in the final budget. And hope that was efficient enough for today, Laura.
That was perfect, Stephanie. Great. It's great to see after last week's 988 fee debate, how many states are actually really considering this. So thank you for those updates. Look forward to hearing more as the sessions continue. Now I'm going to turn it over to our next segment, which is Peer Central. So we have Erin Arrow Foster, who's the Vice President for Peer and Crisis Program Development and Training. And Arrow, I will turn it over to you.
There we go. I got unmuted. Can everybody hear me? Yay, wonderful. So thank you for allowing me to be a part of this really important conversation. And I'm going to do a callback to both Wendy and Monica, because I think they brought up some really good points as it aligns with peer services. So, across this nation, peer specialists are reshaping how crisis is done by entering a lot of different venues, not just through direct service, though, but by bringing that lived experience to the design of the systems that are more responsive, more humane, and thereby more effective. So I want to reflect on 3 key opportunities to strengthen that. And that is the opportunities that emerge when we build with a peer voice as a key component before the fact and not after. So as we've heard today in the crisis system, real-time data plays a critical role. We track volume, response times, disposition rates, and all that information really helps manage those systems and helps us identify trends. But data alone doesn't capture that full experience. It doesn't reflect whether someone felt safe, whether they felt heard, whether they felt empowered. It often misses that emotional and cultural nuance that shape how we experience that care. And we as peer supports bring that missing layer of insight. By walking alongside those individuals, we can bring context and meaning to what the metrics alone can't explain. So if this crisis system is going to be both accountable and person-centered, real-time data needs to be paired with the real-time experiences of peers on the ground. So as Monica showed on her slide as an advanced system identifier, and then Wendy mentioned again, so that we can articulate the impact with this data. Second point is peers have always worked uniquely positioning themselves as connectors between all the systems within the crisis continuum of care, from mobile response to stabilization, emergency departments, community-based follow-ups. Can't even talk about all the legal systems that we're in. This helps sustain that engagement across all these environments. And so that cross-system presence gives a unique ability to the peers to fill those critical gaps, especially when those services can sometimes be siloed and disconnected. They help build the trust, and the continuity keeps that interaction going. So as we aim for that greater integration, we got to embed those peer roles, not just within the individual programs, but across the entire continuum of care. And by that, I mean also embedding that voice in the system design, in the feedback loops, in the metrics, in the IT designs that we have going on in call centers. To truly evolve this, it must be present in all of the measurement of the systems. We need to be involved in co-creating, informing outcome measures, shaping feedback loops, because the voice, the language of those systems needs to reflect the recovery environment that then the actions can back up. And so these feedback mechanisms must include more than just clinical benchmarks that may be required. They need to include benchmarks that are much harder to identify, but can be done, of hope, dignity, connection, empowerment. These are the markers of success from the recovery perspective. So when we participate in defining what success looks like, we become more aligned with recovery values, and therefore we become more effective at helping people heal. So as we look to the future of this, a future driven by data and integration, we've got to ensure that lived experience is not an afterthought. We need to not just be add-ons to an existing module or model. We need to be those essential partners in building that systems that are compassionate, accountable, centered in recovery, whether that is human language, whether that is computer language, whether it is data-driven language, that language needs to be there. So bringing peers to the table during the design and implementation isn't just the right thing to do. It's a strategic investment in creating that crisis system that works for everybody and increases the success rates for the people we serve within that crisis system. Thank you. And I'll turn it back over to you, Laura.
Thank you, Errol. What a great message and such a good tie back to what we heard from Monica, what we heard from the roundtable, what we heard from Kansas. This is really going to take everyone collaboration. So what are we going to do next week? Well, we're going to have a fireside chat with the one and only Dr. Brian Hepburn, and he's going to talk to us from Beyond Beds to 988. No better person to do that than Dr. Hepburn. And I think we maybe have what is coming the week after that, which would be the June 4th debate. So make sure that you stay with us next week and the week after that. I'm sorry, it's not the debate. It is live and on location. Again, that amazing Franklin County facility that we saw again at the beginning. So make sure that you have this on your calendar, that you are sharing this with friends. And if you have your idea, make sure you send it in to us so we can make sure that you are a featured speaker. Thank you for joining us this past hour. Thank you for all the work that you do. We can't do this without you, and we look forward to seeing you next time. Have a great day, everyone.